If you've ever felt burning while urinating, unusual discharge, or discomfort in your lower abdomen, you might have wondered what's really going on. Is it just a simple urinary tract infection, or could it be something more serious like a sexually transmitted infection such as syphilis? These two conditions can sometimes feel confusing because they share a few similar symptoms, but they are very different in cause, risk, and treatment. Today we are going to break it down in a simple and clear way so you can understand the difference and know when to seek medical help. Let's start with urinary tract infection, commonly known as UTI. A UTI happens when bacteria enter the urinary system, which includes the bladder, urethra, or sometimes the kidneys. It is more common in women, but men can also get it. The most common cause is a bacteria called E. coli, which normally lives in the gut but can enter the urinary tract and cause infection. When someone has a UTI, the symptoms usually appear quickly. The most common signs include a burning sensation during urination, frequent urge to urinate even when the bladder is almost empty, cloudy or strong-smelling urine, and lower abdominal discomfort. In more severe cases, if the infection reaches the kidneys, a person may experience fever, back pain, nausea, or chills. UTIs are generally not sexually transmitted, although sexual activity can increase the risk because it can push bacteria toward the urinary tract. The good news is that UTIs are usually treatable with proper antibiotics and increased fluid intake. Most people start feeling better within a few days of treatment. Now let's talk about syphilis. Syphilis is a sexually transmitted infection caused by a bacteria called Treponema pallidum. Unlike UTI, syphilis spreads through direct sexual contact, including vaginal, oral, or anal sex with an infected person. It does not come from hygiene issues or everyday bathroom habits. It is strictly an STI, and it can become very serious if not treated properly. Syphilis is often called a silent infection in its early stages because the symptoms can be mild or even unnoticed. In this first stage, a person may develop a small, painless sore called the chancre. This sore usually appears at the site where the bacteria entered the body, such as the genitals, rectum, or mouth. Because it is painless, many people ignore it or don't even notice it. In the second stage, symptoms can become more noticeable. A person may develop skin rashes, often on the palms of the hands or soles of their feet, fever, fatigue, swollen lymph nodes, sore throat, and body aches. These symptoms can come and go, which makes syphilis tricky to recognize without testing. If syphilis is still not treated, it can move into a hidden or latent stage where there are no visible symptoms, but the infection is still in the body. In later stages, it can damage the heart, brain, nerves, and other organs, leading to very serious health problems. Now here is where people often get confused between UTI and syphilis. Both can sometimes cause discomfort in the genital area or pain during urination, but the key difference is the cause and the pattern of symptoms. A UTI is mainly an internal urinary system infection. It causes burning during urination, urgency, and bladder discomfort. It does not usually cause skin sores, rashes, or whole body symptoms like fever and fatigue unless it becomes severe. Syphilis, on the other hand, often starts with a painless sore, not a burning urination. Later stages involve skin changes, rashes, and systemic symptoms affecting the entire body. So if you notice a sore or rash along with a history of unprotected sexual contact, syphilis becomes a concern. If your main symptom is burning urination and frequent urge to pee without sores or rashes, it is more likely to be a UTI. Another major difference is how quickly symptoms appear. UTI symptoms can develop within a day or two after bacteria enter the urinary tract. Syphilis symptoms usually take about 10 to 90 days to appear after exposure, which means there can be a long delay between infection and visible signs. Testing is very important for both conditions. A UTI is diagnosed with the simple urine test that checks for bacteria and white blood cells. Syphilis is diagnosed with blood tests that detect antibodies against the infection. Sometimes doctors may also examine sores if they are present. Treatment is also completely different. UTIs are treated with antibiotics specifically targeting urinary bacteria, and symptoms usually improve quickly. Syphilis is also treated with antibiotics, but it often requires a specific type like penicillin and may need careful follow-up testing to ensure the infection is completely gone. One important thing to understand is that both conditions should not be ignored. Many people try to self-diagnose and delay treatment, but that can lead to complications. A simple UTI can spread to the kidneys if untreated, and syphilis can progress to life-threatening stages if ignored for years. Prevention also plays a key role. For UTIs, good hydration, proper hygiene, and urinating after sexual activity can help reduce risk. For syphilis, safe sexual practices like using protection, limiting multiple partners, and regular STI testing are very important. Another important point is that symptoms alone are not enough to make a final diagnosis. Many infections can overlap in how they feel, so medical testing is always the safest approach. If you ever experience unusual symptoms like burning urination, discharge, sores, or rashes, it is always better to get checked rather than guessing. At Health Diagnosis, our goal is to educate you so you can understand your body better and take the right action early. Your health should never be ignored or delayed because early treatment always leads to better outcomes. If you found this video helpful, make sure to stay informed, stay safe, and always consult a healthcare professional when symptoms appear.